happens when PPH actually occurs? How do we manage it? So as I said that once the baby is born following a vaginal delivery or following cesarean, if we realize that the patient is tending to bleed heavily, that the oxytocin is not working, the uterus is not contracting, then the first thing we do is we make sure the blood is available. Whenever PPH occurs, it is very important for the caring doctor, for the gynecologist and for the hospital staff involved to act very quickly and expeditiously, because the bleeding or this complication can sometimes evolve very rapidly, leading to catastrophic consequences for the mother. So the first thing, as I said, we do is we check for the availability of blood. We then try to find out what is the cause for the excessive bleeding. As I said, in most cases it is because the uterus is flabby, it is relaxed, it is not contracting. So to take care of this, we give the patient injections called oxytocins. We have very good oxytocin medicines available now, which are very effective in causing the uterus to squeeze and contract. We also perform what is called the uterine massage. We put a hand on the patient's tummy and rub or massage the uterus so as to cause it to contract and reduce the bleeding. We look for any tears in the vagina or cervix that may have happened during childbirth and take care to repair them, and also check for any tissue bits or placental bits that we may have left behind in the uterus during delivery. Most cases of postpartum hemorrhage will respond to these simple measures. However, sometimes in a few cases, patients or this complication may be refractory to the treatment that we have given, and we may need to resort to better measures. In such a situation, if a PPH is not responding to the measures that I have just elaborated, we sometimes insert a balloon inside the patient's womb. It's a special balloon which is then inflated inside the womb. This womb puts pressure on the placental site and helps to arrest the bleeding. If the bleeding is still not getting controlled, sometimes we may need to take the patient to the operation theatre and execute certain specialized operative procedures to control the bleeding and save the mother's life. So dear friends, today we have discussed in detail about postpartum hemorrhage, a dreaded complication of childbirth. As I said, this complication can be unpredictable, so preparedness on the part of the doctor and the hospital staff at all times is very important. It is a complication which needs to be tackled very quickly, very proactively, so that it does not threaten the life of the mother. Most cases of postpartum hemorrhage respond to simple measures like a uterine massage, administration of oxytocin agent, repairing of vaginal cervical tears, etc. But in some cases, we may have to resort to operative measures to control the bleeding. With this, I say goodbye and good day to all of you.